I'm Dr. Zora Ahmed, and I'm going to present this interesting case of a 3-year-old male child who presented with swelling around the knee joint. Here we see an abnormality in the region of fibular epiphysis, where there's a lobulated, partially calcified mass, which is partially obscuring the epiphysis growth plate and extending into the overlying soft tissue. So, on the basis of this, the lesion could either be epicentered in the soft tissue or it could be arising from the epiphysis. So, to characterize it further, we go for an MRI. So this is the MRI of the patient. These are T1 weighted images, and we see that this lesion is located in the popliteal fossa. It is closely related to the epiphysis and growth plate, and it has signal which is similar to the bone. There is tissue overlying the lesion, which is intermediate signal intensity. It is causing mass effect on the gastrocnemius muscle. The epiphysis itself is relatively preserved. These are the PD non-PATSAT images. On this, we see that the predominant part of the lesion is bone signal, and there is an overlying cartilaginous cap, which is T2 hyperintense, and this cartilaginous cap is lying between the epiphysis and the lesion. This is the PD PATSAT image, which shows the cartilaginous cap better. These are the axial PD images, which show the presence of cartilaginous cap between the lesion and the fibula. Post-contrast images do not show any enhancement, which is expected. Diffusion, no restriction of diffusion. ADC map and T1 corner. So, bone osteocartilaginous lesion in relation to the fibular epiphysis. So, the diagnosis of epiphyseal osteochondroma or Trevors disease. So, the diagnosis in our case was epiphyseal osteochondroma, also known as dysplasia epiphysealis hemimelica or Trevors disease. This is characterized by osteochondromas arising from the epiphysis. Typically affects young children, males. It can be either localized or generalized, but it will involve a single limb, mostly the lower limb. Ankle involvement is more common than the knee. On radiograph, we have lobulated ossific masses in relation to the epiphysis involving a single limb. MRI is important for identifying the cartilaginous cap, the signal of the lesion, and also assessing the effect that the mass has on surrounding structures, whether it's causing any vascular or neural compression. Also, it's important for identification of the cartilaginous cleft, which is critical for planning resection in skeletally immature children. So, in the typical metaphyseal osteochondroma, we have continuity of the bone into the lesion. However, in epiphyseal osteochondroma, we generally have a cartilaginous cleft between the lesion and the bone. Epiphyseal osteochondromas are more commonly symptomatic. They present with pain, growth abnormalities, gait abnormality, and so surgical excision is also more commonly required than solitary osteochondromas. Thank you for listening.